Another question that I get kind of along that same line as far as how can it affect my menstrual cycle is also how can it affect my chances to get pregnant in the future. And I want to delve back into potentially why some people have been saying that there could have been some influence from the vaccine on fertility. And that boils down to a former employee of Pfizer that was commenting that the vaccination in some produces an antibody that is a little bit similar in molecular structure to a protein that's on the placenta. So they actually physically tested that to see if the antibodies that were created from the vaccine can somehow influence a pregnancy or bind the placenta, and they found that although that was a theoretical concern, there was no binding of that antibody the vaccine makes in your bloodstream to the placental tissues of any amount. Another potential concern is that inside the drug trial literature for Pfizer, there was some concerns about men not potentially having intercourse within a certain period of time of receiving the vaccine. And also there were concerns saying, okay, if you're part of this vaccine as a woman, you should try not to get pregnant. So they wanted you on some sort of contraception or wanted you not to be having unprotected intercourse. That is pretty standard literature and pretty standard practice for a lot of new medication trials and also a lot of new vaccination trials, because sometimes we just don't know what that potential risk is. There is no evidence whatsoever after looking back at it from the many people that have been vaccinated and have been successfully getting pregnant without difficulty, both men and women. There doesn't seem to be any influence on the ability for these potentially fertile women to get pregnant, and there also doesn't seem to be any influence on the ability for men to have sperm that can actually cause pregnancy. So the vaccination doesn't seem to be influencing anybody's fertility whatsoever.